Hi, let's talk about pulmonary circulation. In this video, we'll compare how systemic and pulmonary circulations are structured. Systemic circulation is circulation from the heart out to metabolically active tissues. It begins in the left ventricle of the heart. That blood is squeezed out through the aortic valve, through the aorta, which is the main conduit of blood to regions of the body. It has three distinct parts: an ascending aorta, arch of the aorta, and the descending aorta, which has thoracic and abdominal parts that are divided by the diaphragm. It's the ascending aorta which supplies the coronary arteries with blood. And we'll discuss the branches of the arch of the aorta and the thoracic and abdominal parts of the aorta in other videos. This blood is returned back to the heart via the vena cava. So superior drains regions superior to the diaphragm, inferior vena cava drains regions inferior to the diaphragm, and the coronary sinus drains the various tributaries that drain the heart directly. We can contrast this with pulmonary circulation. Excuse me. Pulmonary circulation begins in the right ventricle. That blood which is received by the heart from the vena cava is pushed out to the lungs through the pulmonary valve, via the pulmonary trunk, through two main pulmonary arteries, left and right. We designate these as arteries because they conduct blood away from the heart, yet they are carrying some of the most deoxygenated blood in the body. So we shouldn't always think of arteries as conducting oxygenated blood. We should think of them as conducting blood away from the heart. Once at the lungs, there's an opportunity for gas exchange. Carbon dioxide can be released and ventilated away. Oxygen can be ventilated in and load into hemoglobin, and that oxygen-rich blood travels through 4 pulmonary veins to the left atrium. That blood travels through the left atrium and into the left ventricle, where it's going to begin the systemic loop of circulation. So let's look at these structures as we would encounter them in the heart. So there's the pulmonary trunk, which is a rather anterior vessel that is coming from the right ventricle. The pulmonary trunk divides into the pulmonary arteries, which go out to the lungs. The lungs supply oxygen to the blood and return it via 4 pulmonary veins to the left atrium. Through the left atrium to the left ventricle, which is the beginning of the systemic loop of circulation. So we've discussed pulmonary and systemic loops of circulation. It's important to keep these various loops distinct in your own mind, and it's important to realize that arteries conduct blood away from the heart, veins conduct blood toward the heart, and that arteries and veins bear little relation to oxygen status of the blood. This is your summary slide. Thank you for your time.